95 won the buzz. I am Sheryl, and I'm joined by Daria and Dr. Workman, and you guys are killing me over there. You're looking at bikini pictures, and I have never wanted to do summer more.
And this is not by any means, Sheryl, the weirdest thing that Dr. Workman has come in here wearing on his face or person.
What is he doing over there?
It's your 3D goggles, right?
Yeah, we've got some 3D goggles that basically we take patients' pictures, and the software will give you a very good indication of what you look like.
And then you have a program as well here on the iPad where it's a digital imaging, and you can see from all angles.
Absolutely.
You can take those off.
Okay. I like looking at myself.
What your implants would
my
look
man
like,
boobs.
and what you can change the size. You can basically visualize the entire post procedure.
No, absolutely. I mean, we'll take a picture of you ahead of time, you know what you look like now, and we can actually put the exact implant size that that you've selected and morph you into what you might look like with that.
I have a question about liposuction.
Sure.
Is there an area on the body where you cannot do it?
Well, yes, there are certain areas on the body we call zone of adherences, and basically, like right over your breastbone, and oftentimes right on the side of your hips. The skin has very dense attachments to the underlying tissue, so your skin doesn't fall down, so to speak. And those areas tend not to have much fat. Apart from that, most of the time we do liposuction, it's on an area where you have localized extra fat deposits.
Here's a question. What's desirable has changed over the years: size of breasts and the
And booties.
and booties and larger bottoms. Who would have thought, 20 years ago
Yep.
would be desirable? If you liposuctioned the back of the thigh right to where the butt begins, that would make your butt look bigger, right?
It can.
Because that seems like a good idea to me.
Yeah.
Like if you want a bigger butt, and then
Sure.
you'd get smaller back
Yep.
of the thighs.
And taking that one step further, a lot of women have extra fat just at the top of their butt. And if we remove that fat, there's it bulges out there a little bit. You remove that fat, and it makes your butt look bigger proportionately. And so, we're narrowing your torso so that your buttock looks rounder and larger.
So I bet there's some situations where people come in and they think they want one thing, but what they're really asking for is a totally different procedure. For example, if
Absolutely.
someone comes in and says, I want a bigger butt, I want
Yep.
butt implants, and you're like, before we talk about butt implants, let's talk about these possibilities and things that you just mentioned.
Make sure we've maximized what you naturally have.
To find out more about Dr. Workman, including some amazing before and after pictures, or to make an appointment and maybe utilize this new technology, just go to drmichaelworkman.com. Thanks as always, Doc.
My pleasure.